We goofed. That was the admission essentially from the Center for Disease Control Director, Rochelle Walensky, when she called for an overhaul of the agency, saying that in response to COVID-19, the CDC did not meet many of the expectations of the American public. She didn't get into specifics about what they botched and when. It could have something to do with don't wear masks, do wear masks, get one shot, get 50 shots. Anyway, whatever the confusion, they're trying to clarify it now with a complete revamp of the agency. Who's affected and what's affected right now with Dr. Robert Redfield, of course, the former CDC director under Donald Trump, kind enough to join us. Doctor, good to see you.
Good to see you, Neil. Thanks for having me.
What is she saying, Doctor, and is she right? Did the CDC botch it?
Well, Neil, I think at the heart of this is when they really talk about a reset, is what the primary role of CDC is. Is it an academic institution or is it a public health response agency? And when it started back 75 years ago, working with the Defense Department to work on malaria, it was a public health response agency. And what I think it's dwarfed into over the 75 years is to have more of a culture of an academic institution. And I think at the heart of this report and what the director has commented on is it's really time for CDC to look in the mirror, kind of see what it's become, and ask the question, is its culture and structure optimized as a public health response agency, or is it optimized as an academic institution? And I think that's the heart of it. So I think it's an important first step. It's going to be a long journey to try to change the culture of the agency and really make it so it can be a public health response
okay,
agency.
you might be right on that, but
you're
so brilliant, Doctor, you lost me with that. But I do want to understand, I want to get at the brass tacks on this. Is it just the guidance that was given was wrong? And then if we can get into the specifics of that. Wearing masks, it was said originally, bad idea, not necessary, then everybody wear masks. Is it on lockdowns and keeping people home? That was advisable in the beginning. Was that a mistake? And for future pandemics, is the signal that those kind of things will not happen in the future?
Well, clearly the mandates and the lockdowns and the closing of the schools to virtual learning, all of that was a public health mistake. There's no question about it.
But what if everyone had gone about their normal roles at the time, Doctor, and gone back to work, gone back in crowded situations? You don't think that would have, at some level, made things even worse? Or in retrospect, you say, no, it wouldn't? Now, remember, that's pre-vaccine.
I think clearly my view was that we take a pause, evaluate how to do things in a safe and responsible way, but shutting down the schools was much greater public health harm to the kids than keeping the schools open.
So just to be fair, Doctor, I'm sorry to keep jumping on you rudely, but that's an important distinction. You would have not done the school shutdown thing, but you would have embraced, as the Trump administration did initially, with some reluctance, this idea of everyone dialing things back, maybe, doing their jobs from their homes, just not extending that to keeping our kids out of school.
Yeah, I would have been very select on trying to look at each activity, how do you do it in safe, responsible. For example, in the restaurant business, I would have, stopped loud music and people standing around bars, but I would have had people still be able to go into restaurants. I think there was a mistake in those regards. But I think at the heart of it, Neil, and this is what I was trying to get at, CDC has a tendency to come up with information. Once they have all the data, it's all wrapped up in a bow, it's perfect, it's ready for publication in a scientific journal. And what the public health response agencies have to do is take information in real time and try to make real-time recommendations, and then modify those recommendations as the data evolves. But I always give the example of my first briefing that I had as CDC director on the opioid deaths. It was a week or so after I was director. And when I finished the briefing, I asked the CDC experts what the data was through, and they told me it was through March of 2015. And I said, but it's April 2018. And they were explaining to me the complexities of getting data. And I was explaining to them that doesn't help me to launch a public health response based on data that's 3 years old. I think that's at the heart of it. I think that's the heart of what we're talking about.
That does make sense. I do wonder, no matter what the changes are, Doctor, going forward, Is it your belief that vaccines were good, that getting so many Americans, I believe now up to 8 out of 10 vaccinated, was good?
I think it's critical, Neil. I think we've talked about this before.
Yes.
Vaccines are the most important gift of science to modern medicine. They do work. Well, the problem with the COVID vaccine is people need to think of it more like a medicine than a vaccine. In other words, a vaccine you take once and you're done. The COVID vaccine only works for a period of time. Originally, a Wuhan strain, about 8 to 12 months. The UK strain, maybe 6 to 8 months. The Delta strain, 5 to 6 months. The Omicron strain, 4 months. Now the Omicron, 5, probably 3 months. And that shouldn't surprise us because natural infection, if I get infected with Omicron 5, the immunity that I get from that will only protect me for about 3 to 4 months.
Well said, Doctor. Very good seeing you. Dr. Robert Redfield, the former CDC director.
Great to see you, Neil.
Same here under President Trump.